Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below. Hello everyone, welcome. This is Dr. Jacobs. In this video, I'm gonna go over the 9 surprising causes and risk factors for frozen shoulder. You will not believe number 6 and 7 because it's very overlooked by a lot of healthcare providers and has tremendous part of treating the root cause of frozen shoulder. So before I go over the 9 surprising causes, we want to look at the shoulder. And when you have frozen shoulder, you start to have inflammation and thickening in the capsule of the shoulder joint that cause limitation in the range of motion and limited the range of motion of the humerus in relationship to the scapula. So one of the common cause or actually risk factors is if you are 40 years and older. The second cause or risk factor is immobility, and that could cause by a stroke. So when someone has a stroke and do not have mobility in their upper extremity and they don't move their arms, that will lead to frozen shoulder. That's a common cause, stroke. Third cause or risk factor, if you have a rotator cuff injury from accident, trauma, or fall, and you stop moving your shoulder, and that's also immobility related to injury to the shoulder, that will lead to frozen shoulder. So think about it this way: if you're not using your shoulder and you continue moving your shoulder joint, that is immobility, and that will lead to frozen shoulder. The cause could be from stroke, from rotator cuff injury, and actually, believe it or not, it could cause by surgery. So when someone has surgery in the shoulder on the clavicle area and stop moving their arm, that will lead to frozen shoulder. And I see any surgery like mastectomy or lymph node removal related to cancer in this area, and the patient does not move their arm for a period of time, that will lead to frozen shoulder. So surgery, fracture is common with the clavicle fracture that could cause in relationship to disuse of the shoulder joint, cause frozen shoulder. The fifth risk factor is diabetic. So diabetic patient, because they have a lot of inflammation, it's common to see with those patients immediately frozen shoulder. And that's actually related to number 6 and 7, which is hormonal imbalance, especially thyroid hormone imbalance. I see that frequently in a clinical setting, that when someone has thyroid hormone imbalance or hypothyroidism, and those patients usually say, I woke up in the morning and I could not move my shoulder. And it's very common with hypothyroidism. And actually, if the doctor does not address the root cause of the problem or the hormonal imbalance, the treatment is not going to be very effective. So the seventh cause that extremely overlooked is vitamins and mineral imbalance, because you need to have vitamins, for example, C, D, magnesium, for your body to move from inflammation stage to proliferation stage to heal, to decrease the swelling in this area. And if you have vitamins and mineral deficiency, your body will not heal and the treatment will not be effective. So vitamins and mineral imbalance is extremely overlooked by healthcare providers, because they think they don't connect the dot between inflammation, slow body healing to frozen shoulder, and they think it's only fibrotic tissue and overlook the root cause of the inflammation for frozen shoulder. Eighth cause and risk factor is Parkinson's disease, because disuse. And the ninth cause is cardiovascular diseases. The most common, as I mentioned to you, is immobility related to rotator cuff injury or any injury or accident. The other most common is hormonal imbalance and vitamins mineral imbalance, and those two extremely overlooked by healthcare providers. So if you have a frozen shoulder, you need to go to qualified healthcare provider to evaluate it properly. And I will leave a link underneath this video for the 3 most powerful treatment to treat frozen shoulder naturally that you have never heard of. If you have any comment or question, leave it in the comment section and I will answer it in a future video. We'll see you soon. Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below or go to asterinstitute.com.